The chairman of the PTF, honorable ministers, members of the Presidential Task Force, gentlemen of the press. I understand there are no ladies of the press, so gentlemen of the press, good evening. Yesterday, we promised that we will bring forward today guidance or safety advisories with regards to opening up of places of worship. And before I do that, I want to make some clarifications because I know there's been a lot of concern nationwide about the opening of places of worship. There is no doubt that COVID is still around. There is no doubt that it is safer for you to stay at home. There's also no doubt that it is safer for you to worship at home. The PTF is providing safety advisories or guidance in the event that you need to fulfill your spiritual needs and you cannot do it at home. But we are not making recommendations that people should go to places of worship. But if they choose to, we are providing advisories to enable them to do so safely. It is still better to do your worship at home. COVID has not gone away. You only need to look at the numbers. We are in the exponential phase of the illness. We have moved as a country right up to the 3rd position in Africa. And because of our population, we could also move to the 2nd position or even the 1st. So now is the time to continue to take precautionary measures. Now is not the time to relax. It's not the time to relax. So I hope I've made that clear, but I will go through the guidance. And the guidance is really a baseline for states to work on. States are free to strengthen the guidelines, but we would expect them to at least provide that baseline so that our citizens can continue to be protected when they wish to pray in places of worship. So, in view of the widespread community transmission of COVID-19, it is important that places of worship operate in a safe manner to ensure the protection of public health, avoid outbreaks, and safeguard the health of vulnerable members of the population. To this end, the following guidelines have been developed as a minimum set of standards that have to be complied with for places of worship to safely operate nationwide. They have been developed by the PTF in liaison with leaderships of the religious communities in the country and should be used by state governments as a baseline for permitting the use of these facilities. It is important to note that due to the nature of religious congregations, places of worship are particularly recognized to have a major potential for spreading COVID-19 infection among worshippers. And this has been clearly demonstrated in several outbreaks globally linked to religious gatherings. Therefore, places of worship that are unable to comply with these measures should not be allowed to operate by state governments. The following measures are recommended. All places of worship must sign up to full compliance with all aspects of non-pharmaceutical interventions required to protect the public from COVID-19, including but not limited to 1, ensuring the supply of running water and soap/alcohol sanitizers at entry and exit points and in all high-contact locations, including bathrooms. 2, worshippers must sanitize their hands before entry. 3, worshippers must have temperature checks before entry, and the supervision and enforcement of this will be led by the leadership of the various facilities. Use of face masks is mandatory. We strongly discourage all close contacts, including shaking hands, hugging, kissing, handing out of materials, and sharing of worship implements, including prayer mats, musical organs, microphones, etc. The capacity of the facility should be limited to allow for physical distancing of at least 2 meters between persons. Facilities should consider the use of floor or surface markings to guide distancing. And people from the same household should be encouraged to stay together. Local arrangements will apply in terms of the capacity of these facilities, but the most important thing is to make sure that the physical distancing rules apply. Local authorities will also be advised in terms of areas of hotspots that might require greater restriction. Volunteers should be limited to exact numbers needed, and none of the volunteers should have an underlying medical condition or be above the age of 55 years. Responsibility for enforcement will be with the leadership and church or mosque committees, and supported by local authorities, including state governments. B, we strongly recommend limiting congregational contact times, with places of worship only opening for regular church and mosque services. Regular church and mosque services. Churches to open from 5 a.m. and close by 8 p.m. For churches, each service should be for a maximum of an hour, with an interval of 30 minutes in between services to allow time for disinfection. Mosques may open 15 minutes before Adhan and close 10 minutes after prayer for Fajr, Zuhur, and Asr. Prayers to be shortened to reduce duration of contact between congregations. The reason for this is because, as I said yesterday, there are several factors that will contribute to you catching COVID when you come across somebody with it. And one of the factors is the duration you spend with that person. The longer you stay with that person, the less protected the person is in terms of face mask or you yourself. The more closer you are to the person, the higher the likelihood of catching COVID, which is why we are trying to limit the duration of contact within crowded communities. For Friday prayers, mosques are to open 20 minutes before prayers and close 20 minutes after prayers. The total time for Friday prayers, including sermons, should not exceed an hour. Islamia schools, night vigil, Sunday school, and children activities are to remain suspended. For mosques, only the 5 daily prayers and the Friday prayer services should operate. Mass gatherings that make compliance with physical distancing impossible is not allowed. Ideally, prayer sessions, if necessary, should be staggered to accommodate people and to encourage greater opportunity for physical distancing. Worshippers should be encouraged to sign up for preferred service time where possible in churches and make virtual worship options available. Places of worship should plan, if possible, for separate entry and exit points. But it's also mandatory that they have to have measures to direct the flow of people to avoid crowding and breach of physical distancing rules. There should be no social gatherings either before or after worship. And business outlets within the churches or mosque premises should remain closed. We are strongly advising vulnerable individuals, such as those with underlying conditions such as diabetes, cardiovascular disease, immunosuppression such as HIV and cancer, those above the age of 55, to please stay at home and consider remote participation or non-contact attendance. When we looked at the mortality rate, the death rate for persons who have died from COVID in Nigeria, the case fatality rate, well, first of all, more than half of those that died were above the age of 50. Secondly, the case fatality rate, if you're above the age of 50, was 17%. If you're above the age of 60, it's 18%. It's almost 1 in 5. A 1 in 5 chance of dying if you catch COVID and you fall within that group. There should be improved environmental hygiene and clear decontamination processes. So, for instance, places of worship should ideally be free of carpets to allow easy and regular disinfection of floors and furniture. Where this is not possible, then arrangements should be made by places of worship to ensure deep cleaning of the carpets. Windows should be left open during services, and preferably use non-enclosed spaces or open-air services as much as possible. If you are staying in an enclosed environment and somebody coughs at you, the likelihood is that the droplets will probably reach you if you are close by. If you are outside, the wind may carry it away and it may not necessarily target you. So that's why staying outside is safer than staying indoors when it comes to close contact with a lot of people, mass gatherings. Frequent cleaning and disinfection should occur for high-touch surfaces, high-traffic areas, common areas, and bathrooms. This is because we know apart from respiratory droplets directly contaminating people and getting infected, the second most frequent cause of infection is people touching contaminated surfaces and touching their face. We recommend using dilute bleach to disinfect all surfaces regularly after removal of visible dirt. In terms of keeping infected persons out and reducing the risk of onward transmission, public awareness campaigns should take place through effective messaging using conventional media and online outlets and placing of signs and notices at strategic locations within the facilities. This information should address common symptoms of COVID, the risk of transmission, and the vulnerability to severe illness, etc. Worshippers should be reminded not to attend in person if experiencing common symptoms of COVID-19, including fever, cough, and shortness of breath, or have had close contact with an infected person in the last 14 days. All worshippers noted to have a temperature or are symptomatic on arrival at the place of worship should be turned back and not allowed admission. Places of worship should ideally keep up-to-date records of their staff, including contact details, and if possible, a record of attendees at church services, for instance, or even at small mosques to enable contact tracing in the event that somebody comes up positive. And considering the dangers posed by the pandemic, we strongly recommend that religious visits to homes by religious clerics should be discouraged. These guidelines provide a baseline for the states to then develop their own policies specific to their areas, depending on the prevalence of COVID, depending on whether or not people are likely to follow and comply fully. But we will be reviewing these guidelines from time to time, and we will definitely review them if it looks like we are having issues with regards to this relaxation. And I plead with the public to understand with us, but more importantly, to please continue to stay safe. It is better to stay at home and worship than to go into a place of worship. Thank you.
Thank you very much, National Coordinator. I think I'll still have to invite you back to the podium just to say a few words on effective use and disposal of PPEs.
Apologies. So, when it comes to personal protective equipment, we have different gradings of PPEs. We also have a guideline in terms of rational use of PPE. Globally, worldwide, there's a move towards rational use. It depends on the sort of services you offer, whether you're a healthcare worker or you're out in the community. Regardless of that, PPEs are supposed to be safety equipment. They do get contaminated following contact with infected persons, and they need to be handled safely. They also need to be disposed of safely. I don't know the background regarding the video, but as the chairman said, it's important that the public, including parents, realize the importance of avoiding contaminating themselves with not only PPE, but also anything that has to do with a hospital setup, such as needles, such as swabs, etc., because you can pick up other infections as a result of it. Where you do come across discarded PPE, please notify your local authorities, particularly the environmental health sections of the local authorities, or even contact us if it is within the FCT, and we'll make arrangements to pick them up. As far as we know, hospitals know what to do when it comes to discarding and disposing of PPE safely, and this needs to be abided by. Thank you.